Okay, everyone, welcome. Were any of you? I know, seriously. What am I doing? How many? How many were here last year? Raise your hand. How many were here 2 years ago? Okay, lovely. And then I'm gonna do the same thing that Jessica did. Who is in the room? Are we all patient advocates? Do we work at hospitals? Do we like? What's the? Do you work at a hospital? Raise your hand. Lovely. Okay, independent patient advocate. Raise your hand. Okay, most of it. And then shout out the other things. Okay, say that again. Community, lovely. Anybody else? Reimbursement. Okay, very cool. My name is Jared. I'm the founder of an organization called $4. It's really interesting because 2 years ago I spoke at this conference, and $4 had just kind of exploded in a weird way. But I want to talk to you a little bit about how we got started, what we do, how we do it, how it works, and then give you all some examples on how we enforce hospital charity care. How many know what hospital charity care is? How many would say that you're like an expert on hospital charity care? Okay. We have a couple experts. That's intimidating for me. You can correct me if I say anything wrong. So we enforce hospital charity care policies, and but it didn't start out that way. I grew up in Portland, Oregon, and I watched my own family go through a medical crisis. So my wife and I were sitting at home. She got a phone call. Her aunt had passed away from cancer. And then a few minutes later, I got a phone call. My cousin had gone into labor, 7 weeks premature. Baby needed a heart surgery to live. And what was the big conversation? How are we going to pay for it? That was frustrating for me. That was kind of like the first run-in I had with the lovely American healthcare system. So it was this frustration that said, okay, well, how can we help? So I had this brilliant idea of crowdfunding in Portland, Oregon. So I would post up at coffee shops, breweries, music venue, cannabis dispensaries, like you name it. And people would sign up for small recurring monthly donations. Every month we would pool the money together and we would pay medical bills for people in our community. Just one family at a time, 1 month at a time, nothing too crazy. We would partner with local organizations. They would tell us about families, and then we would raise money for them. So I'm doing this for years. And then I meet Eli, who, if you were here last year, you met Eli. He is now general counsel at $4. He's awesome. And he said, what the hell are you doing paying all these bills? If they're low income, there's something called charity care. And I am staring at him like a chump because I had never heard of this, but I've been doing this for years where I'm like, I'm paying medical bills for low-income families that all would have been eligible for free or reduced care if I would have known about this. So then that fueled my rage a little more because I'm like, well, this is so dumb. But also I had that same thought that everybody, all the patients that we talk to all the time is like, is this even freaking real? Is this a real thing? Like, no, there's no way that this exists and they're not telling us about it, right? Wrong. So I started meeting up with Eli, and we would just dig through these policies. We'd read all the policies. And it was always like, oh my gosh, like this hospital goes up to 300% of that, and this hospital goes up to 400%. And we're in Oregon and Washington, so the hospitals there are usually pretty good with that stuff. So we were always shocked. And then we're like, well, we have all these patients. Why don't we see if it actually works? So we started filling out applications for people. And we were going through and like just mailing in applications. We had no idea what we were doing. We had no idea if this would actually work. And in a few months, we got $1 million of medical debt to disappear for people in the Portland metro area, which is insane. Yeah, thank you. And it was like, I mean, I was probably like 4 years into doing crowdfunding, and in those 4 years, we had raised like maybe $200,000, and then we got $1 million in a month. So that was wild. But at that point, I'm like, well, we have uncracked the code. Like, everybody's going to want to know about this. So I start like reaching out to all these media outlets and saying, hey, like, there's this big thing. Nobody knows about it. This is in 2019. It's called Charity Care. Like, why aren't there any stories about this? What is going on? And I just wasn't having any luck with it. It was like, we would love to write a story. Do you have a patient with a really large medical bill? And then they would write a story, and it would just emphasize how bad the healthcare system was, and how, so like this happened. And I was like, oh, this is it. We're like, it's going to blow up after this. There's no way. Like, we got an article in Time. We got this huge medical bill relieved, but it's like, a 5-page article, and it doesn't even mention Charity Care or like explain what it is. It was just like, oh yeah, and then there was this organization that helped. So that was awesome. So anyways, I'm like thinking, okay, how do I get this out there? Because again, like, I'm talking to all these people, and no one has any idea what Charity Care is. People don't know. So it is Thanksgiving. My little sister is in town. She goes, you should get on TikTok, and you should make a TikTok video about this. And I'm like, that's dumb. I'm not going to do that because I can't even keep up with like the other social media platforms. So I ignore her. And then she's in town again for Christmas, and she's like, yo, did you make that video? And I was like, no, I haven't. So I thought about it. I was in my office late one night, and I'm scrolling through TikTok for the first time. And I see this video that is, what is a piece of information you've learned that feels illegal to know? Have we all seen that, Stitch? And I was like, oh, I know the answer to this one. This is easy. So I made a TikTok video, my first TikTok video ever. And it just happened. We got a whole lot of views. People started talking about it. Charity Care was in the headlines, and it was great. So we had here's the problem. $4 at the time was just me. And I had tens of thousands of people reaching out asking for help with their medical bills, because in the video, I told people to DM me if they needed help, which was a dumb idea. So it was like, we got overwhelmed. I did not know what I was doing. So when I spoke 2 years ago, that was like a few months after that had happened. They had seen the organizers, Liz and Melissa, saw this TikTok. They reached out to me, and I got to speak here. But even while I was speaking 2 years ago, it was like, this was all happening. It was like, it was still just me, I believe. It was a shit show. So it was like, what's going on here? Okay, so in the last couple years, we have grown. We had a couple amazing people reach out, started as volunteers. They said, hey, let's make a database of every hospital in the country and log all of their Charity Care policy data. Because that's the problem. Well, one of the many problems is none of this is standardized. There's this federal law that says, hey, hospitals, nonprofit hospitals have to have Charity Care in order to keep their nonprofit status, and it's how they show the IRS that they're providing community benefit, and that's all great, but what are the rules? Every single hospital has different rules, different income guidelines, different, we'll get into some of the wild things hospitals have for their Charity Care stuff. So we wanted to capture all of that, but there's like 7,800 hospitals, and that's a lot. So we got about 50 volunteers, and we started researching every single hospital in the country and logging into this database. So now a patient can go to our website, put in their household size, income, what hospital holds the debt. It will tell them immediately if they're eligible for their hospital's Charity Care program, and then we complete the necessary paperwork, submit it to the hospital, and advocate on their behalf until the medical bills are gone. So I believe when I was here 2 years ago, I had just made these $5 million t-shirts of like, we just hit $5 million in medical debt relief. And I was wearing it It was the coolest thing. We just hit $31 million in medical debt relief. So thank you. And we are helping patients all over get charity care, and educating people on what it is, how you can fight the hospitals on decisions and all of that. So our mission is a little bigger. We want to make charity care known, easy, and fair. Because right now, nobody knows about charity care. Even if you do know, how do I say that? Hospitals make it really difficult. So even if you do know, it's difficult to access. Most, I would say 90, 95%, Erica, maybe, of hospitals require you to fax your applications in. Or mail, or it's like, and that's just one part of like, if you go to, I mean, even just the viral TikTok video, all it was me getting on my computer and showing people how to find their hospital's charity care application, because it's not on the homepage. Like, I always challenge people, go to your hospital's website, try to navigate to the charity care page. You won't find it. So if you don't know what you're looking for, it's hard to access. And then at the end of the day, hospitals call the shots. They get it wrong a lot of times. They deny people that shouldn't be denied. So it's this whole thing. We want to hopefully help patients alleviate medical debt right now. And then we are collecting a tremendous amount of data that we can show to hospitals and say, hey, we have 10 patients at your hospital that are having this problem, and it shouldn't happen. So what are we going to do about it? And try and figure out how we can work, well, sometimes work with hospitals, sometimes shame them into changing, so whatever we need to do. So this is, oh, whoops, that is not supposed to be up there, sorry. I'm just kidding, that was a joke. We would not be able to fit our shit list onto one page. Okay, so these are like some of the challenges that we see at hospitals. And since it's like a smaller group, I would love this to be more conversational. I want to talk about some specific cases that we have, and then just kind of, because everybody knows about charity care, I don't need to go into like, well, this is what it is, and this is what 501, section 501R4 says, or whatever. We can talk about like specific cases. We can talk about some of the things that we see at hospitals that have worked when we come across these barriers, like insurance. So we see a lot of the times, I'd say maybe 50% of hospitals in our database will say something about insurance. If you have insurance, any type of insurance at all, you're not eligible for charity care. How many have seen that? Okay. We see it all the time. The question is that legal? Can they do that? All of these things, yeah. So then we have a minimum bill amount. Minimum bill amount, how dumb is that? It's like if your medical bill isn't $5,000 or more, you don't get charity care. It has to be a certain amount. That one I can actually say that is illegal. They can't do that, but they do it. Has anyone seen that on a policy? A minimum bill amount? Yeah. Erica, thank you. Erica works for $4. She's a patient advocate. She has seen it. Okay, residency. So, do you have a question? I would say Texas, Florida, Georgia, because that's the answer to all bad questions. I'm like, so we'll start there. North Carolina. But I've seen them, like, they creep in into a few. I mean, I've never seen them in Oregon, Washington, or Colorado. Utah. You've seen it at Utah? What hospital? Centura? Say Centura. Oh, yeah. Okay. Love that. Yeah, so I think OHSU in Oregon used to have it. They got rid of that. But yeah, I would say the main ones, Texas, Georgia, Florida, North Carolina. But anyways, and sometimes it's $1,500, but I've seen it all the way up to $5,000, which is insane. Okay, so then we have residency. And I live in Washington State, so there is the Canadian border right there. And there's this big idea that there are just droves of Canadians coming into America to get like healthcare. So yeah. So it's one of these things where people think we need to create rules around this, because if people from other countries come in and use our healthcare system, like that's this bad thing. So they have these residency issues. But then they start saying, well, if you're not a resident of the state, you can't access our charity care program. You have to live within the state. Then we see, well, you have to live within these counties or zip codes or you don't get charity care. So we see it broken down into, it gets smaller and smaller and smaller, which is, again, insane. And a lot of times, I will say this, no matter what, whether it's a person from a different country, a different state, a different county, if it is emergency care, you are eligible for the charity care program. We can get into that later. But residency, so no refunds. If you are eligible for charity care and you find out that you're eligible and you've been on a payment plan, the hospital is legally required to refund any payments that you have made. Has anyone been able to get a patient refunded money? It's the coolest thing ever. When you get the medical bills to go away and then they get a check in the mail, it is so dope. It is great. How many knew that is possible? How many knew that was, or I guess how many didn't know that? Okay. If you get somebody that has been on a payment plan, I just made a video the other day and a whole bunch of people are commenting, is charity care still available if you're on a payment plan? And there's this idea, because hospitals tell people this, it's like, oh, well, you're already on a payment plan, like that ship has sailed. That is not true at all. They would actually have to refund you. So that is a very important thing to know. This slide is taking way longer than it was supposed to. Care credit. So right now there's this huge investigation happening by the CFPB. Anybody hear about this? Okay, so the CFPB, it's so exciting. So care credit, you're at the hospital and somebody comes in and says, hey, can you pay this medical bill? You can't. Okay, well, we have these great options for you. One of them, a lot of time, is these credit cards. They're no good. They're no good, people. They're no good. So what happens is, and this is why I always say charity care, because charity care, like, you can't confuse with anything else. A lot of the times the hospitals refer to this as financial assistance. But financial assistance could be a lot of things. Financial assistance is a payment plan. Like if you say, hey, I need help, they say, oh, well, we have many financial assistance options for you. Let me tell you about this care credit card. So always be specific about charity care. Care credit cards I believe, are predatory, no good. People, especially when you're telling patients about it and they're eligible for free or reduced care without it. Don't push your credit card on somebody. So the CFPB is doing a big investigation on that. We'll see what happens. Stay tuned. And then fake deadlines. So no matter what, you have 240 days to apply for charity care. Does anybody know about that deadline? Raise your hand if you knew about that deadline. Okay, you have 240 days no matter what. That's like the federal minimum for charity care. But some states, like Washington or California, and I think Oregon, they will extend that. So you can go beyond 240 days. But what we see all the time, and we have an example of this happening later, is a patient applying for charity care within that 240 days. And then the hospital comes back and says, we need more information, and you have 30 days to respond. So now the 240 days doesn't exist anymore. Like, it was almost like applying hurt them, because now they only have 30 days to respond. And we've seen that we've seen that be as low as 15 days. You have to respond in 15 days with 10 days? What hospital? Multiple hospitals, people. Multiple hospitals. Yeah, so we see those deadlines, again, like shorter and shorter and shorter times. You can't do that. You have 240 days no matter what. And then in some states, you have longer. So these are challenges that we see all the time, every day. Yeah, we see that a lot where, and okay, I get that at some level. Like if you can get, the hospital wants to get paid, right? Like at the end of the day, if they can get paid. So they want, like charity care is the last line of defense. They want to see, but some hospitals are so annoying about it that it's like you have to show proof that you did this and that you know that you're on like, and a lot of times the patients that we're serving have been screened for that and didn't apply because there is a big gap. Like you might not be eligible for Medicaid, but then you're still within the charity care guidelines. So Medicaid as another barrier. Any other things that you are seeing in hospitals? Yeah, so one thing that we see all the time, and this is kind of goes into my next slide, this lovely story. So how do I start this? Hospitals don't like bad press. We have been told multiple times, they say, don't write us a letter from your attorney because then our legal department has to get involved and like that can even make things worse or at least slow it down. We are much faster to respond if there's bad press. Like we would much rather, like they love letters from attorneys. I mean, they don't love them, but it's better than an article. So what we've done is we've tested that out. So we had a patient. She had a $35,000 bill. She was eligible for charity care. We had screened her. It was like no question within the income guidelines. We submitted all the documents because we do this all the time and we know exactly what Banner wants. So we submit it all. It goes back and forth. We need more information, blah, blah. But it was like we had already sent in all the information. So then the hospital says, hey, 30 days is up. Sorry, you don't get charity care. This is like a single mom, $35,000 bill. I don't even think she made $35,000 total. So we send an appeal. They ignore it. We send a letter from our attorney. They ignore it. We send another letter, and we're like, what can be done? Like, what do you do in this situation? And this is like, I mean, I feel like we see this so much where patients are like, the hospital's not responding. They're just not getting back to me. They're not doing, like, what do you do? Because there is, they would, like, if you were to talk to someone at the hospital, they would say like, oh, we have this appeal process. It's like, well, I've already done that. Like, I've gone through all of the things. So we made a video and we posted it. And we just said, so, okay, this is how this works. And this is we tried this once, or I mean, we've done it a lot, but this was our first one that we did. So I made a video, said, hey, everybody, this is what's going on. Can you get Banner's attention? And then they got Banner's attention. So you can see it was a bloodbath, you guys. It was terrible. Like, and it wasn't, I would say our followers are pretty respectful. Nobody was getting too crazy. It was stuff like this, like, hey, do the right thing. Shame on you. I love this one. So shady, giving the patient the runaround so you can claim they went over the 30 days and then they're asking the hard questions. How much financial aid do you actually even give out each year? Blah, blah. So they're like getting this. And then if you go to Banner's page, all the comments on Banner's page, it's like they like go through all theirs and like, hey, why haven't you called $4 back? Blah, blah. So we post this. 30 minutes go by, and you know who calls me? Banner. Freaking Brad. Brad from Banner. Brad from Banner calls me, okay? And it was fixed. It was fixed immediately, people. Like, it was one of these things where it was like, he was like, hey, saw the video. Like, what is it gonna take to get that taken down? Like, how do we get this taken down? I'm like, well, it's not getting taken down. I can turn off the comments though. But he responded immediately, and $35,000 gone for that patient. So what have we learned? Like that, I mean, that is insane. That is what it took for us to get a response from this hospital. And we have the privilege of having a larger audience on social media. And then we have people like Christy and people like Jessica, and people like Abby that are going to make it not fun for the hospital. that help like get this out. So we have like collectively, there's 1 million followers that are like out against this hospital. Not every patient has that, right? I mean, most every patient doesn't have that, but that's what you have to do sometimes to get like what is supposed to happen. And yes, you can file complaints. You can do like there's a lot of different ways, but this has been effective for us on multiple occasions. But this isn't like to tell people, hey, so just start a social media page and start blasting hospitals. Like that's not it. It's more so to just highlight like this is what it takes sometimes, and it's so annoying because you would think like we don't have to do this again with Banner, right? But Banner isn't like they're still on the shit list, people. Like they're still. I'm just kidding. No, they are. So then, and here's a couple other things. So we are like we want to make charity care known, easy, fair. So how do we change policy so that people don't have to go through it later? So one thing at Banner that we saw in their policy was no refunds. They just had it. Like they just had it blatantly out there in their policy. We don't give refunds. You can't do that. You have to give refunds. So we called them. We said, hey, it's a whole story. And Christy was involved with that one a lot. But if you go to their policy now, they give refunds. We were able to change that. That's great. But that's like one little tiny thing in their policy. How many people does that affect each year? I mean, a lot. Banner's like a 31 hospital system throughout 6 different states. It's a big system. But and they changed that policy because we gave them hell about it. But there's a lot of hospitals and a lot of bad policies. So it's like, what are we doing? Are we just going to pick these off one by one? Or like, what is like the bigger change that can happen? This is another quick example. Northwestern Hospital, $12,000 bill. Patient was eligible, obviously. We submitted the documents. We go back and forth. So the hospital says, hey, this patient isn't a resident of this state. And it was Illinois. What was it? Palos Heights, Illinois. If you look, that's like a bordering city, a bordering town. And there's Indiana that is 20 miles away. This woman worked in Illinois. She lived in Indiana. I live in Vancouver, Washington, but Portland, Oregon is 10 miles away. So we're saying, hey, and it was an emergency. So we're going back and forth with this hospital, and they just are not budging. So what do? We blasted them again. So that again, we're going through all of the steps.